Hello everyone, I'm Dr. Seibel, a professor at the University of Massachusetts Medical School and founder of Health Rock. My goal is to help America stay well because it's better to stay well than to get well. I want to spend a few minutes today and talk with you about something that's very important. It's called osteoporosis. Osteo meaning bone and porosis meaning thin. So thin bones or too much calcium coming out of the bones. Now, why should you care? Why should it matter? Did you know that 1 in 2 women after the age of 50 and 1 in 4 men after the age of 50 is going to have some kind of fracture due to osteoporosis? Now, that could be due to a fracture of your vertebra, your backbone, which causes women to have a kind of a hunched over, or men to be kind of hunched over, the so-called dowager's hump. It could be a broken wrist, it could be a fractured pelvis, it could be a fractured hip, or other bones in the body. So there's a lot of things that can happen, and there's about 2 million people every year that have a fracture due to osteoporosis, and about 80% of them are women. And osteoporosis affects 10 million people in the United States. 80% of them, or 8 million, are women, and 20%, or 2 million, are men. Now, there's a number of things that are really important for you that you can look into in order to help you prevent osteoporosis. We're going to talk about those in just 1 second, but first, how do you make a diagnosis? You don't see your bones. You don't even feel your bones a lot of the time, so they're kind of quiet. They don't seem to have any life in them even. But our bones are very much a living tissue. They're not like those Halloween skeletons that are like hanging up in the Halloween time. The bones are very living, and all the time they're building tissue and they're correcting and fixing themselves. It's called bone remodeling. And bones get laid down, our bones start to build primarily in childhood. Kids are growing. So by the time kids have finished high school, certainly by the time they finish college, they've got about 85% of the bone that they're ever going to have. All that calcium is being put in the bones while we're young. Then as we get older and approach menopause, or we approach age 50 for men, the calcium starts to kind of come out. It's kind of coming out of our calcium savings account, which is what I would call the bones, the calcium savings account. So we've got to make sure we get plenty of bones strength built up while we are young and continue to maintain it while we continue to grow. Now, the things that are helpful for you is to make sure you get calcium and vitamin D in your diet. And you want to make sure to make a diagnosis sometime around age 40 or 50 to see if you have osteoporosis. And how do you do that? Well, you would ask your doctor, or I ask my patients, to get a bone density. That's a test, kind of like an X-ray, but very little radiation. It's only the amount of radiation that you would get if you were going in an airplane from New York to Los Angeles. So not very much radiation. And as a result, you can see how dense your bones are, how much calcium is in your bones, and you can compare that to the amount of calcium in the bones of other women your age, and the calcium that's in the bones of women who are around age 20 who are at optimum bone age and bone density. And that'll give you some idea if you are losing bone. Now, here's some tips that I want to give you that can really help you prevent osteoporosis. Let's look over here for a second. Number 1, get enough calcium and vitamin D. Make sure you get at least make sure you get 400 to 800 units of vitamin D every day. A lot of the multivitamins will actually have that much vitamin D in them. And make sure you get a vitamin D level drawn to make sure yours isn't low, because you might need even more than that to keep your bones strong. The second thing is to get enough exercise. All of us should be exercising approximately 20 to 40 minutes at least 3 times a week, ideally 5 times a week, and it ought to be weight-bearing exercise. That's the kind of exercise that is putting our feet on the ground, where we put our weight down on our feet, and walking is a great one, but you can also do it by strength exercises and weight-bearing exercises. These are vitally important and will really help you to keep your bones strong. Number 3, don't smoke or drink too much alcohol. Smoking is one of the worst things that you can do for your bones. It just sucks the calcium right out of your bones. So avoid that for bone strength. And also, drinking more than 2 glasses of wine or 2 alcoholic beverages a day is certainly a negative effect on keeping your bones strong. The next thing, number 4, is get a bone density. I mentioned that. It's a type of an x-ray, very low radiation, and that will tell you exactly how strong your bones are compared to other people, and if you're losing bone at too fast a rate. And I suggest everybody get one at least by age 50. If you have a family history of osteoporosis, and even at age 40, get one of those. And finally, number 5, get treated if it's needed. And that's something that we really have that's different today than was maybe a decade ago. We now have medications that can really stop you from losing more bone, and some that can even put calcium back in your bones. So talk to your doctor about the kinds of treatments that are available, and make sure that you prevent osteoporosis. Remember, the only way to treat it is the diagnosis, and the only way to get the diagnosis is to talk about it with your doctor, get a bone density, check your vitamin D levels, do these 5 tips, and it'll help your bones to be strong. This is Dr. Seibel, and remember, it's better to stay well than to get well. And you know, if you'd like any more information, we have lots of information on our website, drseibel.com, DOCTORSEIBEL.com. Stay well, everyone.